how do you become experienced in hand therapy, or how do you get mentorship? So the easiest way is to just get experience during your field work or your clinical rotations if you're a PT or OT. And I would say that's like my top recommendation because you're generally going to work in hand therapy as a student for 3 months, and you have like a general idea of how to work as a hand therapist. Plus, you won't need as much mentorship, and you can work in an outpatient clinic or directly under a physician. And I feel like that just provides you with a lot more flexibility to negotiate salary and to get a job. Now, some outpatient practices offer mentorship, but it's not always that easy to find these types of jobs. Now, you can also take training courses online or through universities, but these courses can be expensive and they're really not that necessary, I would say, overall. You can also gain experience in hand therapy by learning how to splint without patterns. And I go over this in this video here, but I also talk about it in my new book, all about splinting without patterns. I'd recommend just getting experience as a student if at all possible. And if you're a licensed therapist and you don't have any hand therapy experience, it's best to just start out by taking hand therapy CEU courses. I recommend using MedBridge. I think it's just a really easy platform to use. It's not that expensive. They have a ton of courses on it. And I have a discount code if you want to try it out. It's OT Focus. So I'll put that in the link in the description and a link to their site. So another thing is if you want to get into hand therapy, but you didn't have that experience as a student, I would say just take a course, and then you want to do as much splinting as possible, and then just shadow like a hand therapist for like a good 2 weeks. And I feel like that can give you a really good idea and direction in how to get in the field. And then if you have other therapists at your clinic, that's going to be really helpful. But if not, if you have like a surgeon that's there that will kind of be around to help you out, that's going to be really helpful. So most people aren't going to be kind of left on their own to do everything. And usually you can reach out to another therapist in the clinic to have some guidance on what you should do. So I feel like you're not going to be all on your own. There are going to be people around you to kind of help you out. So I would say for those people that haven't done this before, get your feet wet, go for it. There's a really good hand therapy book that you can use. It's called the Indiana. It has all the hand therapy protocols. I'll put that in the link in the description as well. And it's just kind of give you pretty much like everything you need to know related to any condition. So if you have a patient that comes in with carpal tunnel or tendonitis or an amputation, it has all the protocols. So you can just quickly look in that book and get a general idea of how you should treat this patient, what the protocol is, when you should start splinting, and when you should take the splint off. It helped me so much. I feel like that book helped me better than any mentor, because when I started hand therapy, I did not have a mentor. I had a surgeon that was working in the same office. So every once in a while I would go talk with him if I had a question, but I didn't have like a mentor that was constantly there watching me. But I did do it as a student, and I felt like that kind of made me feel a lot more comfortable. But yeah, use the Indiana protocol. It's really good. It's super helpful. It's just going to give you everything you need to know to get started. I would say get the book early, just read through it, get pretty comfortable with the protocols, but you don't need to have them memorized. And then anytime you get like a complex case, I would say refer to the protocols so you know what you're doing. For me, I'm going to say like hand therapy certification is worth it. First of all, if you want to do this the rest of your life and you want to get really good at it, I would say definitely get the certification. It's going to give you that knowledge base. It's just going to be really helpful. And even if you don't pass the exam, getting all that knowledge is going to be beneficial to you in the end, whether or not you become certified. And say you can take the certification exam, not become a hand therapist, and still be a good hand therapist. You're not going to be certified, but you can still be an excellent hand therapist. And I think that's all that matters. So for a lot of us, you don't have to get certification if you don't need it. For the people that are definitely like, I want to do this the rest of my life, I would say get the certification, renew the certification every 5 years. I think it's just going to be worth it for you. All right, I hope you like this video. Definitely like, subscribe, and I'll see you in the next one. Thanks.